What is diabetes? It is a metabolic disease of high blood sugar. Diabetes is caused by a decrease in insulin hormone secretion, or a decline in the body's ability to use it effectively, resulting in an accumulation of glucose or blood sugar. Insulin hormone is a hormone that helps regulate blood sugar level, and it helps to introduce glucose molecules into cells to be stored or used to produce energy. Failure to treat diabetes causes serious complications, such as nerve and blood vessel damage, eyes, kidneys, and other body organs. Types of diabetes. The type of diabetes varies according to the cause, which is 3 types: type 1 diabetes, type 2 diabetes, pregnancy sugar-ins. Type 1 diabetes is also called childhood diabetes, an autoimmune disease, i.e., the body's immunity attacks and destroys pancreatic cells, resulting in severe insulin deficiency. Type 1 diabetes usually gets sick in childhood and needs insulin daily. Type 1 diabetes patients are 10 diabetic patients. Type 2 diabetes is the most common type, usually associated with obesity. Type 2 diabetes is caused by the body's resistance to the hormone insulin and cell response disorder to the hormone so that glucose accumulates in the blood. Pregnancy sugar is the case of high levels of blood sugar during pregnancy only in a pregnant woman. The placenta disperses hormones that inhibit the action of insulin. The pregnancy sugar patient recovers after giving birth automatically. Preliminary diabetes. It is a condition where the sugar level is higher than normal, but it is not as high as diabetes. The normal sugar level is between 70 and 99 mg/dl. The level of fasting sugar in a diabetic is higher than 126 mg/dl. And in the case of prediabetes, the sugar level is between 100 and 125 mg/dl. Prediabetes is prone to type 2 diabetes, but The causes of diabetes vary according to type. The causes are: the cause of type 1 diabetes is not fully known, but there are some factors associated with diabetes, such as attack and destroy the body's immunity cells of insulin-producing pancreas cells. Genetic factors stimulate the immune system by a particular virus, which attacks pancreatic cells. Type 2 diabetes is usually associated with both genes and environmental factors as a patient's lifestyle, and some groups are more likely to develop type 2 diabetes than others. Factors that increase the risk of type 2 diabetes include overweight, age progression, patients age over 45, having diabetes in the family, inactivity and lack of mobility, pregnancy diabetes, high blood pressure, high cholesterol, or high glycerides. Pregnancy diabetes is due to the following reasons: hormonal changes during pregnancy, placenta secretion of hormones reduces cell sensitivity to insulin, overweight, having preeclampsia, over 25 years of age, type 2 diabetes in the family, having PCOS, the birth of a child weighing more than 4 kg in a previous pregnancy. Symptoms of diabetes are often caused by high blood glucose. Symptoms can be too mild to be observed, especially in type 2 diabetes. Some people do not know that they have diabetes until complications occur. In the case of type 1 diabetes, the symptoms are more pronounced and appear quickly within days or weeks, and the symptoms with type 1 diabetes are also more severe. Hunger and fatigue. The body converts food into glucose that the body uses to produce energy. Glucose enters the cells only with the help of insulin. Although the body is unable to produce enough insulin, or suffers from insulin resistance, the cells will not be able to benefit from glucose and energy production, causing a constant sense of hunger and fatigue. Constant thirst and frequent urination. A natural person may need to urinate from 4 to 7 times a day, but diabetic patients may need much more. The reason for this is to increase the excretion of glucose through the kidneys to get rid of it in the normal state. The kidneys return glucose particles to the bloodstream. But in the case of diabetes, the body disposes of glucose through the kidneys, and glucose pulls with it a lot of fluids through the kidney. Dry mouth and itchy skin. The patient is dehydrated by frequent urination. because the body depletes a lot of fluids in trying to get rid of glucose through the manufacture of urine in the kidneys, leading to dry mouth and lack of skin moisture that causes itching. Blurred vision, changing fluids levels in the body, lead to swelling of the eye lens, changing its shape and losing its ability to concentrate. Problems with erection in men, libido, decreases in men with diabetes, as well as erectile dysfunction. Unintentional weight loss, the lack of energy that body cells need, leads to the use of fats and muscles to produce energy, resulting in unchanged weight loss in the diet. Nausea and vomiting. When the body burns fat, it produces molecules called ketones, which can build up in the blood significantly and cause a serious condition called diabetic ketoacidosis. These ketones may cause nausea and vomiting. Every person at risk of diabetes must perform periodic examinations to detect the disease early in case of infection, and pregnant women must follow the level of sugar during the second and third trimester of pregnancy. Diabetes is diagnosed based on the following blood tests. Analysis of fasting sugar. The level of blood sugar after fasting is checked for 8 hours. Cumulative sugar analysis. This examination reveals the level of blood sugar during the 3 months preceding the analysis. Random sugar analysis. Blood sugar level is measured at any time of the day, and this analysis does not require fasting. Random diabetes analysis alone is not used to diagnose diabetes. To diagnose pregnancy sugar, the doctor conducts the following tests for the patient between 24 and 28 weeks of pregnancy. Glucose challenge test. Blood sugar level is measured an hour after drinking a solution containing sugar. Glucose tolerance test. For this examination, the pregnant woman must first fast all night, and then be asked to drink a solution containing sugar, after which the level of blood sugar. Although diabetes is a manageable disease, it is a serious disease with serious complications, some of which affect the daily life of the patient and others may lead to death. Complications caused by diabetes are diseases of the gums and teeth, problems with vision and vision loss, problems in the feet such as anesthetics, which causes pain and injury, and which leads to sores, heart disease, nerve damage, or diabetic neuropathy. Stroke. Type 1 diabetes treatment. Treatment for type 1 diabetes includes compensation for insulin deficiency, and the patient needs insulin treatment several times a day. Some of its types are given before or after meals. Type 2 diabetes treatment. Some patients may benefit from diets and exercise to regulate their blood sugar level, but if the patient does not respond in these ways, he may need to take medication. A doctor may prescribe one or more medications to the patient depending on the progression of the disease, and type 2 diabetes may need insulin treatment in certain conditions, such as pregnancy or prolonged hospital stay. Medications used to treat type 2 diabetes. Metformin. Metformin helps reduce blood sugar level, increases cell sensitivity to insulin, and also helps to reduce weight. Glucagon-like peptide receptor catalysts. Glucagon-like peptide receptor stimuli are prescribed for atherosclerosis patients. Sodium and glucose vector inhibitors. Sodium and glucose vector inhibitors are a new group of drugs. Sulfonylurea group. The sulfonylurea group stimulates insulin secretion from pancreatic cells. Treatment of pregnancy sugar. The pregnant woman must monitor the level of diabetes during the last 2/3 of the pregnancy. Having a chronic illness such as diabetes can be a cause for concern, and the patient may become stressed as a result. The patient should know the ways that enable him to control the disease to improve the quality of life. Self-monitoring of the sugar level is very important for the patient, as it helps to regulate meals, physical activity, monitor the effect of medications and insulin on the glucose level. The patient should make sure the cleanliness of the hands and the serviceability of the examination strips before conducting a self-examination of the blood sugar level. A diabetic patient is always advised to follow a diet, exercise daily to maintain the blood sugar level. Also, the patient must adhere to taking his medications on time. Having diabetes causes stress and anxiety in the patient, and stress may raise the blood sugar level, so the patient must learn to control stress. The patient should daily look for wounds, sores or inflammations on his hands and feet. Regularly monitor the blood sugar level. The patient is also advised to quit smoking, maintain oral and dental hygiene, and alcohol should be avoided, if alcohol can raise blood sugar and blood pressure. Attention to the diet.